Hi, I'm Rhonda Capuano with the Trumbull Health Department. Welcome to Healthy Town, a show where we examine the health of the community in order to strengthen it. Joining us today is Dr. Rich. Welcome and thank you for joining us. Today we're going to talk about diabetes and Dr. Rich, how he helps treat his patients who suffer from diabetes. I'd like to first read a little introduction about Dr. Rich's background. Dr. Rich is a board-certified internist, endocrinologist, and diabetes and obesity specialist. After graduating from Cornell Medical College, Dr. Rich completed training in internal medicine at Columbia University and endocrinology at Harvard. Dr. Rich is honored to have been selected as one of Connecticut's top docs in endocrinology every year since 2010. He's been in private practice with the Fairfield County Medical Group located in Trumbull for the past 25 years. Welcome and thank you for being here today and sharing your important information with us. So can you discuss what diabetes is?
Well, first of all, thank you very much for having me here today. Diabetes is a disease where the body is unable to regulate glucose and carbohydrates normally. The way an individual normally would regulate glucose is the body makes insulin from the pancreas, and then the insulin then affects different cells in the body where the body can then absorb the glucose and use that normal functioning. In diabetes, it's either a problem with the body's ability to make the insulin or inability for the insulin to work properly at the sites of the cells.
And are there more than one type of diabetes?
Yeah, the high blood sugar then will cause many issues. There are more than one type of diabetes. The two major types of diabetes are considered type 1 and type 2. Type 1 is was used to be called insulin-dependent diabetes or juvenile diabetes. And in that case, it is an autoimmune process where the body, for whatever reason, sees the cells of the pancreas, the islet cells that make insulin as foreign cells, and attacks those cells and damages them. With that type of diabetes, without being able to make insulin, the person will not live very long without insulin, so the only treatment for these patients is to be treated with insulin. Type 2 is a much more complex type of diabetes. There are many mechanisms involved and many defects that we see in individuals. We often see them in older people who are overweight. There's a lot of genetics components that are involved in that. There is some defect in the ability to make insulin, but you can't make insulin. There's what's considered to be what's called insulin resistance, where the body does not respond as well to insulin as it should, and those combinations will cause a rise in blood sugar. And again, once the blood sugars are high, the high blood sugars then can go around the body and cause much damage throughout the rest of the body.
Well, why is diabetes reaching epidemic proportions in this country?
If you look at diabetes, it has been rising over the last 20, 30 years. And it's mainly type 2 diabetes that has been rising fastest. If you actually plot diabetes rates with obesity rates, they almost parallel. So clearly our diet, our lack of exercise, our weight gain, the obesity that we see in many individuals, that weight gain is triggering diabetes in many people. And when I first trained 25 years ago, it was very unusual to see a young kid, somebody 18, 19 with type 2 diabetes, because there wasn't as much overweight kids at that age. Now I see it all the time. People that are 18, 19, 20 who are diabetics and who come in with diabetes at a much younger age. The type 2 diabetes was always used to be type 1 in the past.
Are there any specific individual people who are prone to develop diabetes?
There are many factors that can contribute to diabetes. And type 1 diabetes is more, it's a low risk of genetic stuff, about 3%. If your parents had diabetes, you have about 3% chance of having diabetes, but that's much harder to predict than type 1 diabetes. Type 2 diabetes, the adult onset or the insulin-resistant type, it's much more genetic mediated. If one of your parents have diabetes, you have about a 50% chance of developing diabetes throughout your lifetime. Weight contributes markedly to your risk of developing diabetes. If you had things like gestational diabetes or things like polycystic ovarian syndrome or insulin resistance, then your risk of having diabetes is much greater. So I think a lot of it is lifestyle, and a lot of things that what in our society does these days contributes to that.
Well, can a person do anything to help prevent them from developing diabetes?
In type 1, there's probably not very much. It's just important to try to catch it early, and it's usually much more quick onset. Type 2, there are many things that we can do to try to help people to prevent diabetes. You can't change who you are. The genetics you can't change, but you can change the other stuff. You can change your diet, you can change your exercise, you can work on weight reduction, and all of those things are such huge importance in terms of weight gain. And the other thing I think is teaching our youth how to eat better and work better towards healthy lifestyle really makes a huge difference. And I always go back to a story, and it's probably appropriate since I'm in a high school doing this interview, that probably about 5-10 years ago, I had a student who was a high school football player who played football and then went to college where he did not play football. On the high school football team, since he was a lineman, they would teach him to eat lots of food so he'd be able to bulk up and to be a good lineman. And he did fine in high school. He went to college where he still had the same eating habits, but he didn't exercise. And he came back 40, 50 pounds heavier after a year because he was eating more, not exercising, and developing diabetes. So I think getting that healthy eating style in the high school students, in the younger kids, to try to build that in the future makes a huge difference. And then there's environmental things growing up in a household that tends to have more weight that also can contribute to that.
Why is diabetes such a serious medical problem?
Diabetes is a serious medical problem, mainly for what it does. If you think of it, diabetes, the blood sugar goes throughout the body. And the body does not like high blood sugars. And depending on what organ it is, it sort of damages many of the organisms. It leads to heart disease, kidney disease, eye disease, probably one of the biggest risk factors for heart attacks, probably the biggest risk factor for amputations and kidney failure. There's some dementia related to that, so many things in terms of what it affects. So it's all that blood sugar. And then you have some acute stuff where you have very high blood sugars where you get very ill for them, and that's important.
So those are quite a few complications that a person with diabetes can develop. What are the cornerstones for treatment then of diabetes?
Cornerstone is there's a multifactorial thing with diabetes. In type 1 diabetes, it's insulin. The body can't make insulin, so you need to give back insulin. In the past, 100 years ago, before they discovered insulin in Canada, people would die from type 1 diabetes. They had no insulin, they couldn't metabolize stuff. Today, they have good treatment in terms of insulin, different mechanisms for giving that. In type 2 diabetes, we now have many medications and stuff. Clearly, diet and exercise and weight reduction will make a huge difference. And we have medications for multiple different classes of medications for diabetes, mainly to try to lower the blood sugars, to try to control the diabetes. But when you look at diabetes, you not only want to control the diabetes, but you want to control some of the associated features with that. With type 2 diabetes, there's a very high incidence of these patients also having high blood pressure and often having high cholesterol. So controlling all of them to try to decrease the risk is very important. So you really need to take a full approach to the patient as a whole person, not just a disease, because there are many things that go on with diabetics.
What is the role then of diet and exercise in the treatment of diabetes?
They're huge. You can't underestimate how much diet and exercise can make a big difference. Almost anything I do, if somebody wants, they could overeat it. If you're going to eat whatever you want anytime you want, your blood sugar's going to go high. Your body can't metabolize that as quickly. You could try to control it, but it's very hard. But diet and exercise, both weight reduction And, and exercise can really decrease, first of all, can decrease the risk of developing diabetes. But when you have diabetes, it can really help control the numbers and make you a much better patient. And again, I'll go back to another story I had, was a patient who was probably in his 60s, who for years I could never control him. I would give him more and more medications. His blood sugars remained elevated no matter what I did. And then 1 month he came back and he was perfectly controlled. And I'm going, okay, I didn't do anything. What happened? So I asked him what happened, and he had a grandchild. And he said, I want to be around for my grandchild. And he started watching diet and exercise, and his blood sugars became amazingly controlled. I decreased many of his medications and even discontinued some of them. So really, you can't underestimate, a patient needs to do it. It's unlike other diseases, unlike high blood pressure or cholesterol, you take a pill, you're pretty much done. With diabetes, it's a life-encompassing disease. What you do affects it. Your stress level will affect it, your diet will affect it, your exercise will affect it, and so many other things that we can't, intangible things will affect your numbers. So that's real important to realize there's a life-changing thing also.
It's too bad you can't write a prescription for the birth of grandchildren, right? What kind of medications are available then to treat patients with diabetes, and how do they work?
For type 1 diabetics, and you also can use it in type 2 diabetics, is insulin. As I said, the main thing for the body pancreas makes insulin, and we now have better forms of insulin and better ways of giving insulin, either through injections or through pumps and stuff. And the insulins are much more smoother and quicker acting, so it really helps our ability to control that. In type 2 patients, there are a whole slew of medications. When we look at diabetes, we look at the different mechanisms involved, the different defects that are involved. One defect is the body doesn't make enough insulin to control the glucose, and there are some medications, some of the older medications that can increase glucose production, and some of the newer medications also can help with that. There's also some resistance to insulin, and some medications are geared to try to decrease that insulin. The liver will release sugar over when you're not eating, and especially that keeps people from not passing out overnight. You need sugar, and your liver will release sugar overnight. So one of the problems with diabetics, they make too much of it and release too much, and that sometimes explains why people have very higher blood sugars in the morning than when they go to sleep, and then medications to try to prevent that. We also know now some of the gut hormones also have a major effect on diabetes and are not working normally in type 2 diabetics. So now we have some medications that work to try to correct the gut hormones, and things called GLP-1 agents sort of control that. And then we also know now that the kidney sort of does not control glucose regularly in diabetics. So now we have some medications to try to correct the abnormalities we see in kidneys. So depending on what the major effect is on the patients, and we often use different classes to try to complement the treatment. So, and it's much more complicated. In the past, we had very few medications, very few choices. Now it's become a much more complicated field with many different medications, some better for some patients and some not. But we have a whole class of different medications out there now.
Well, what are your goals in treating patients with diabetes?
My goal is keeping them healthy.
Okay.
The key is keeping people healthy. And our goals, if you look at the ADA and the American Association of Clinical Endocrinologists, they use what's called a hemoglobin A1C, which is a monitor for a 3-month average for blood sugar. And depending on which society, some say under 6.5 or under 7 should be the goal for people. I think that's great as a big goal, but I think the thinking right now is more towards individualizing patients. And some of the individualization, young people that are healthy and have no complications, you want to get them pretty well controlled, because higher blood sugars can lead to complications. So their goals may be very different than an older person who has multiple complications, who would be at risk for side effects from the medications. So I think the goal is to pick medications that you think are safe, things are healthy, and will help prevent their complications. So it's very individualized. There are some medications that can cause weight loss, so some of those medications sometimes you'd want to add in. somebody with heart disease or some medications that sometimes can reduce the risk for heart disease or strokes. So depending on the individual, you would try to tailor your treatment. But I think it needs to be a much more individualized treatment than a cookie cutter of everyone at one goal. I think that's not the right way of doing that anymore.
Well, then how can you judge how well someone is being controlled with their diabetes?
Well, the easiest way in terms of blood sugar controls is the hemoglobin A1C. As I said, a hemoglobin A1C gets around the individual numbers that you have. So if you have a hemoglobin A1C that's under 6.5 or 7, they're probably under well controlled. If you have a number that's 10 or 11, you know they're not under well controlled and much more risk for complications. But you also have to look at the numbers sometimes, because if you're getting lows, if you're getting a lot of low blood sugar, then that's not a good thing. So you have to look at the numbers and that. You also have to look at other parameters. You want to try to make sure that cholesterol is controlled. You want to make sure they're not smoking. Smoking will double or triple the risk of the complications, things. You want to make sure that blood pressure is controlled. And so you really want to try to help them prevent complications and stuff, and that's the key. And you want to make sure you, amputations a big risk with patients, so you want to make sure the feet are okay. You worry about blindness and stuff, so you worry about making sure they have eye care. So there's a lot of different things you want to do in terms of monitoring that and judging how you're doing. So
it sounds like because it's so interrelated with so many other issues, it's almost a team approach.
Yeah, with that thing, often you need many different people involved. Or you definitely need an ophthalmologist involved, often need a podiatrist involved, often need a diabetic educator, which I have in the office, that is involved in terms of teaching the patient. Nutritionists are huge roles, and then they have complications. Cardiologists or vascular people are sometimes involved. So there are many, many different fields that are involved. And I sort of think of an endocrinologist just as the sort of the quarterback of the team, so to speak, and trying to get everything else under control.
So are there any routine care a patient with diabetes should be aware of? And I know you mentioned a few.
Yeah, I think the few major things is, first of all, smoking. I think counseling the patient for smoking, I think, is key, because smoking with diabetes is asking for trouble. Eye care, especially after a number of years. Diabetes is not the vision that you see. It can damage the vessels in the eye, so you may not realize you're having a problem until it's too late. And if those vessels break, you could go blind, so you want to get things ahead of time. So seeing an ophthalmologist or retinologist, depending on what you need, once a year is usually advised. Good care of the feet, looking at your feet, making sure there's no ulcers, cracks in the feet, and if you need to see a podiatrist, I think are important. And then I think just the exercise and diet and stuff, eating well and doing all that stuff is important. And I think it's just the general maintenance of patients. I think some of the other things that are often helpful is making sure they're vaccinated, especially for things like the influenza. Diabetics who get the flu get much sicker than other people. Also the pneumonia vaccine, diabetics who get pneumonia are more prone to pneumonia, get sicker. So making sure they have those routine vaccines also, I think, are very important in trying to keep the patients healthy.
Well, a shameless plug here, that Trumbull Health Department does offer those vaccines. But anyhow, I know you mentioned a lot of advances in some of the medications. Are there other advances in treatment with the diabetic care?
Yes, some of the, let me go back to the advances in medications. I think now our paradigm of how we treat diabetics is changing. In the past, we always knew, dating back to about 25 years ago, when there was a big study called the Diabetic Control and Complication Trial with type 1 diabetics, that showed that type control decreased the risk for complications. But the complications that we always saw that would improve was called microvascular complications. Complications like eye disease, kidney disease, nerve disease, neuropathy, and those were improved by blood sugar control. But for 25 years, we were never able to prove that we could prevent some of the more worrisome complications like heart disease, strokes, amputations, and that was one of the big problems with diabetes. You could control the blood sugars, you could control some of these microvascular complications, but until recently, there was no way to know whether you were preventing the cardiovascular complications. So over the last few years, the government had mandated that new medications really look into this when they came out. And over the last couple of years, a lot of these studies have come out. And now there are a couple of medications that are out there that either decrease the risk of heart attacks in patients who have a history of heart disease by a significant amount, and there are medications that can decrease the risk for heart attacks, strokes, and deaths in patients with diabetes. So I think now, not only are you looking for trying to get good control, you're trying to individualize the patients to try to reduce the risk of that high risk for heart attacks, if they've had a heart attack, to reduce their risk for deaths. So these medications now have dual roles, not only for blood sugar control, but for complications. And I forgot the second part of that question.
Oh, so then I was going to ask you, are there any other treatments that are on the horizon that you hear that are in development?
I mean, I think there are new drugs hopefully coming out in the future. In terms of type 1 diabetics, I think there is a lot coming out in terms of how to control them better and some of the things that have come out. One of the nicest things, type 1 diabetics need to monitor themselves very closely, and I think one of the greatest advantages in type 1 diabetes right now is what's called the continuous glucose monitors. And there are some companies that you could put a little pod onto you, and it could hook up into your phone and give you blood sugar readings every 5 minutes and tell you which way you're going. So that'll also, for type 1 diabetics, one that controls, when you try to control somebody well, you worry about getting them too low, where it could be very dangerous. But now, if they're getting too low, they can have a something going on, buzz going on in the smartphone to warn them, and the blood sugars are going too high, that can warn them. It also shows them how the blood sugar, are you rising very rapidly or falling very rapidly, so they can make adjustments and changes and stuff. So I think that has been one of the new recent advances that has been wonderful. And probably this year when I was at a lecture, at one of the endocrine lectures, one of the speakers was a diabetic that I was unaware of at the time. And in the middle of his lecture, his phone went off and he said, I need to stop for a second, my blood sugar is going low. And he stopped, got something to eat, went back and gave his lecture. But I'm not sure he really would have realized that with the adrenaline of a talk and all that stuff. You may have missed the signs of low blood sugar, and that could have been very dangerous. So with these new devices, you sort of have that level of safety, and you have much more information. I think that's a wonderful thing. And now with the pumps are getting, insulin pumps for people with type 1 diabetics are getting better, and they're actually working on some of these smart pumps that really almost take you out of the picture and just sort of see your blood sugar and make the adjustments using these continuous monitoring, makes adjustments on their own. And they're actually working on a pump there to both give you the insulin and some of the counter-regulatory hormones somewhere in the future that if your blood sugar is starting going low to help pick your blood sugars up, that really, I think, revolutionize diabetic care for type 1 diabetics. So I think that's going to be important.
So great use of technology.
It's great, yeah. It's doing programming, artificial intelligence, and all these programming models. And for type 2, I think as more of these studies come out for the new medications, we can see which ones are beneficial in terms of other stuff that we're trying to prevent. So I think there is a lot of stuff on the horizon, and it's still doing work in trying to prevent type 1 diabetes and type 2, but that's, I think, ways off.
So a lot to look forward to. Thank you for sharing with us all your important information, and I'd like to thank you for joining us on Healthy Town. We'll see you soon.
Thank you.